Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions,
common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
go above and beyond.
They become very good at what they do, but only
0.1%
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
with Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. My guest today is Toni Engram. She's a biological dentist, an integrative health coach, and owner of Flourish Dental Boutique in Richardson, Texas, which I believe is right outside of Dallas. So we're going to talk about her unique way of going about dentistry. She's had struggles with her own health and autoimmune disease. So it's not just dental, it sounds like. It's more of like a holistic, whole body approach, and we're going to learn about it. So welcome, Toni. Thanks for coming.
Thank you so much for having me. I'm glad to be here.
Yeah, if you would, tell me a bit about your background. What problems did you have that led you to change how you do dentistry?
Well, it's definitely not how I started in my career. That is for sure. I really just wanted to be a quote unquote normal dentist. But around 2011, I just got really sick. I was working full time as an associate dentist for, working for somebody else. And I had a toddler at home and I was opening my first practice from scratch. So it was a startup practice. And I was just a little overstressed, overextended, and burning the candle at both ends. And it just didn't go very well for me. So I had, a lot of GI symptoms, was not feeling good. Had doctors kind of just blow me off and tell me that it was IBS. Here's some peppermint oil. It'll be better in a few months. But it wasn't better in a few months. And finally, I started losing weight when I wasn't trying to lose weight. Started having severe enough symptoms that I got them to, they finally said, okay, well, let's do a colonoscopy. And they discovered that I had a pretty good flare-up of Crohn's colitis. So I got to learn all about autoimmune diseases during that time. And they gave me the very, very typical Western medicine solution, which is here's your list of medications that you're going to be on probably for the rest of your life. And oh, by the way, you might need surgery at some point to remove all or part of your colon. And it just is the way it is. They told me my diet had nothing to do with it. They told me there was really nothing else that I could do, that I couldn't get rid of it. I couldn't solve it. And none of that sat well with me, whether it just intellectually didn't make sense or I was just stubborn. Who knows what the real reason is? But I kind of went on a mission. I had to become my own doctor and go down all the rabbit holes of trying to actually get well. And thankfully I did. I used a combination of the medications for a while just to kind of get me over the hump, and then lifestyle changes, diet changes. And I did start to feel much, much better. And what I realized as I was going through that whole process was, man, everything that I'm treating in myself, it all has to do with inflammation and an imbalanced microbiome. The bacteria that's kind of out of whack. And that's exactly what I treat in my patients every day. I treat tooth decay and gum disease. So it's all about inflammation and solving the dysbiosis in the mouth. So I decided that if I could figure out how to heal myself, then I had the responsibility curiosity to figure out how to do the same thing for my patients. And so that's what led me down the path of oral systemic health and biological dentistry, and haven't looked back since. It's been a lot of fun.
Yeah, no, that's really great. So what are some of the things that you will focus on? Like, do you have your own protocol for wisdom tooth extraction or just a cleaning, like, periodontal cleanings? Like, how much of your practice is different from what you get from a normal dentist?
Yeah, so I would say that a lot of what we do is the same. So we still do cleanings and fillings and crowns and extractions and all of those things, but how we do it is often where the difference is. So when we're doing fillings and cleanings, we're very intentional with the products and the materials that we use. We really try to minimize the impact that we have on the body, whether that's, avoiding fluoride because of potential side effects, potential toxic effects of fluoride. We're very careful with how we handle those old silver fillings, the ones that are half mercury. So we're very intentional with the products and the materials that we use. But we also just really try to focus on prevention over treatment anywhere that we can. And we do a lot of nutritional counseling. So the goal is to avoid needing to be in my chair as much as possible.
So what do you have protocols depending on, like, one thing I thought of is, if someone's diabetic, it really needs to be like a whole set of protocols of diabetic dentistry, I guess I would call it. Like, come in, let's say every quarter or at least every 4 months instead of, twice a year, maybe once a year. You get like a periodontal cleaning once a year or something. And, because the people with diabetes, like what I understand, their mouth reflects the rest of their health. So it'll be very important to really, really keep after it more than most folks.
Absolutely. Yeah. With diabetes, especially, it lends itself towards more severe gum disease and vice versa. If you've got gum disease that's not well managed, then it actually makes it harder to manage your blood sugar as well. So absolutely, every patient is different. So there's no one set protocol, but you're spot on in that diabetics typically do need to see us more often. And we do have protocols where we're using ozone and laser treatments and things like that to make sure that we're minimizing the inflammation in their mouth, because that's going to help minimize those flares that they'll have of their diabetes.
What happens to somebody that has blood sugar problems? Like, what do you see in the mouth?
It's typically inflammatory. So more bleeding gums, more bleeding, more dry mouth because it impacts the quality of the saliva. We see poor wound healing. So if we do need to do some dental work, then often those patients heal slower and we have to be prepared to manage that. But yeah, those are the big ones.
Can you tell if someone's a mouth breather or a nose breather, depending on the state of their mouth?
Very frequently, yes. Breathing through your mouth also dries out your saliva. So much more of a tendency to getting cavities if you don't have good salivary flow to rinse that bacteria and plaque away from your teeth on a regular basis. So more cavities. The pattern of inflammation is different with mouth breathers. So a lot of times we'll see inflammation in the gum tissue right in the front teeth, but less so in the back teeth. And that's kind of a clue that we need to ask more questions about that.
Oh, interesting. I don't know what other unusual health conditions that really show up strongly in the mouth. Any come to mind?
I can pick out somebody who has sleep apnea with fairly good accuracy. That has a pretty strong pattern. Some of it actually starts with anatomy, with just how the face and the mouth and the jaw develop. So a narrow jaw often leads to a narrow airway. And then if we see a tongue that's too big for the size of the mouth, scalloped borders of the tongue, it'll get kind of this crinkly, like a pie crust, like really pretty pie crust. That's what the sides of the tongue will start to look like. Flattened teeth. So all of those things are triggers that there's some kind of airway issue going on. condition, some kind of disturbance in breathing.
Interesting. I just wonder if like any autoimmune disease that show up in the mouth or other ones. And I don't know if medical literature even talks about this. I wonder what are other things you could see, based on the condition of someone's mouth that would correlate with other diseases.
It does. Like there are some lichen planus, pemphigoid, pemphigus are kind of autoimmune signs that we see. Dry mouth, people with Sjogren's syndrome, that's autoimmune. That's, will have really severe symptoms in the mouth sometimes. So yes, definitely autoimmune conditions can be seen in the mouth. Sometimes they have, really telltale signs. And sometimes it's like if we're connecting something that doesn't primarily show up in the mouth, it's usually a secondary sign like rheumatoid arthritis or Hashimoto's, thyroid issues. Those other autoimmune illnesses, they don't necessarily show up in the mouth as anything other than inflammation. So then we're looking at the health of the gum tissue. We're looking at salivary testing to see exactly which bacteria are present. Are there too many of the pathogenic bacteria, or are there not enough of the beneficial bacteria? So we're looking at all of those things to give us clues so that we can hopefully see if there's anything going on in the mouth that's either contributing to their health or contributing to their illness.
Yeah, I was going to ask you about the microbiome of the mouth. And as I understand, there's many different microbiomes. Which ones do you sample preferentially?
Well, there are over 700 different bacteria in the mouth that we know of. And so I like one particular test from a company called Bristle that's checking for over 700 different species. And it can really show us the strains that we know are pathogenic and many of the strains that we know are beneficial. It can show us strains of bacteria that help produce nitric oxide in the body, those that are associated with gut health issues or gut imbalances. So I like to test as many as I possibly can.
With 700 there, that's a lot. But I've heard like under the tongue, there's it's like a localized, less oxygen-rich environment. And then over the tongue, it's much more, maybe the back of the mouth, less oxygen gets there. Maybe not. If you use those,
just a little bit. Yeah, if they're a nose breather versus a mouth breather, then you'll have shifts there. Really the main, I would say in the mouth, most places inside of the mouth are going to be fairly consistent. You'll get, like, if somebody has gum disease and you're getting down into, like, below the gum line into a disease pocket, really below gum tissue, then sometimes those areas are more anaerobic. There's not as much oxygen in there. And so you'll see the difference in the anaerobes versus the aerobes there, which is fantastic when we can see those on a saliva sample, because that really gives us the best information on how we fight it, because we're going to deal with anaerobes differently than we're going to deal with aerobes.
Yeah, that makes sense. I don't know, are there certain protocols that you use depending on the microbial condition of someone's mouth to bring it back to a healthier state?
Absolutely. Yeah, for sure.
Oh, like certain probiotics and stuff?
There are certain probiotics. Some of the pathogenic bacteria are sensitive to the chemicals that other bacteria produce. So we can be really strategic with the types of probiotics that we use. And sometimes not. Sometimes you've got pathogenic strains that aren't sensitive to any of the probiotic, but they're associated with poor health effects, associated with things like cancers and, increased risk of diabetes, increased risk of heart attack or stroke. And so sometimes it's taking, a theoretical blowtorch to the mouth. Like we're using our stronger antimicrobials, like we're going to use a strong rinse in some cases for a short period of time, not forever. I don't want people rinsing with the stuff in the blue bottle for long periods of time, but sometimes we do need to use an antimicrobial and really knock down the bacterial levels before we build things back up.
So what, I don't know, when someone comes to you, like what will they experience that's different from a regular dentist? What kind of assessments do you do that, are different?
So we try to do a saliva test on all new patients who come in. if we can get you to do it, that really does help us be able to treat you. So I really love salivary testing. We test pH. So we have pH strips and we test the pH of everyone's saliva. So we know how acidic things are, how neutral things are. And really a huge tool in my tool belt is a cone beam CT, and it's just a fancy low radiation 3D x-ray that helps us see helps us measure the size of the airway, helps us see into the sinuses, helps us look for all kinds of hidden infections, look at where the wisdom teeth used to be, look in 3D around old root canals. It just really gives us a ton of great information. And then we're using all of that data to pull things together to really be strategic and personalize everyone's care to their specific mouth.
So what kind of results have you been able to get? I know everyone's different, everything is different, but what kind of surprising things have you been able to accomplish that maybe the patient or you were like, wow, and I didn't know this is possible. Traditional dentistry doesn't seem to touch this normally.
Well, we've had some really interesting cases where we've gotten bone to grow back just by using lasers and ozone, which I was taught in school, once you lose bone around teeth, that you never get that bone back. But we were actually able to get some bone growth back in the area just by using very, very natural, safe methods like some laser energy and some ozone. So that's so rewarding when you can do that without having to do major surgery. I've had patients who, after several miscarriages, we've found out what was going on in their microbiome and were able to clean up some gum disease, and they went on to have healthy pregnancies. So cases like that are really rewarding.
Oh, that's great. I don't know. Are there any other things you're seeing in the mouth that are unusual? Maybe you haven't figured them out yet, but you're thinking maybe there's correlations. Like, is it taking you into new directions where you're coming up with new protocols for various problems? Kind of is proprietary. I understand you can't say, but I'm just curious.
Yeah, well, I don't know that anything is necessarily proprietary. I think that we're discovering new methods and new protocols all the time, which is really exciting. I really think that we're entering a phase where more and more people realize that it was a mistake to separate medicine and dentistry 150 years ago, whenever it was separated, that really the mouth, believe it or not, the mouth is connected to the rest of the body. And it's our job as physicians of the mouth to be able to remove any barriers that patients have to healing and getting well.
You mentioned in your bio about specializing in removing fillings, I guess, with mercury in them, like amalgam fillings. Is that right?
Mm-hmm.
Yeah, I have one from 36 years ago. I had one cavity in my whole life. I don't even know if it was a real cavity, but it has mercury in it. And so does mercury leach your entire life, or does it kind of slow down and go quiet after a while? And should you remove it, or sometimes should you keep it?
It's interesting. We know now that the half-life of mercury in those old silver fillings is 50 years. So in 50 years, you'll have gone through about half of the mercury vapor in that tooth.
Okay.
And so that's the thing, with anything, just like you're not going to necessarily have lung cancer if you're smoking one cigarette, it adds to the toxic bucket, right? All of these things add to the toxic load that we're asking our bodies to deal with and to handle. So for some people can have a mouthful of amalgam fillings and do just fine. But then there are other people who only have one or two or a few. Maybe they're having symptoms. And while I can't, I think it's impossible to correlate getting one of those old silver fillings to a specific disease or health outcome. I see some really interesting coincidences where if we safely remove those fillings and they're doing their part at home to help detox and clean things up, they're working with a naturopath or working with a functional medicine doctor, then I see these patients who feel better once they get those removed. So I'm careful to stay in my lane, and I'm not going to say that these are directly causing harm, but man, I sure think it's worth questioning. And I think it's also worth taking care of ourselves if we're going to have them, most people aren't getting these anymore because most dentists aren't placing them anymore. But when we have them removed, then I think it's worth a very careful look at how you're having them removed, because you are going to get more of a mercury exposure during the actual removal and replacement of these amalgam fillings.
Yeah.
Because
Exactly.
it's dozens of times, multiples more, because mercury vapor is released by heat or friction on those old fillings. It's bound to the rest of the metals in the filling until you apply heat or friction. And so anytime you're eating, if you're grinding your teeth, drinking hot coffee, you're going to have teeny tiny little exposures of mercury vapor. But if I, as a dentist, take a high-speed drill at 800,000 RPMs to that filling, that is a massive amount of heat and friction. And so you get this plume of mercury vapor that can fill the whole room. And if it's not done carefully, if it's done by someone who doesn't respect the mercury, who doesn't believe that there's any kind of risk at all, then you'll get this huge, massive exposure to mercury during the procedure itself. So I think at the very least, it's worth taking a more careful look at how we do these as a profession.
Right. There's some people that are asymptomatic, maybe leave them alone. People that are having a lot of trouble, it's worth it, maybe.
Right. I have some people who choose to leave them if they're not bothering them, they're not having any issues, then totally their choice. And I have some people who they're also not bothering them, but they just don't like that their body is having to deal with that exposure, even though it's small, all day, every day. And so they'll electively have those replaced.
What are the symptoms to tell you that someone's having a problem?
It really just depends. Some people will come to me with testing from their naturopath where they've, done either hair samples or urine testing, and they're finding heavy metals in their system. Sometimes that's how patients come to me. And then, some people, they have an underlying neurological issue or a neurological disorder, and they're just wanting to cover all their bases. If somebody is trying to heal from brain fog or neurological issues or whatever the case may be, you're just trying to do everything right and cover all those bases just to make sure that there's nothing that might be contributing to not being well.
But what are some of the symptoms of mercury poisoning? If someone's really not doing well with it, what might they feel?
Well, mercury is a really potent neurotoxin. So these are primarily neurological symptoms. So brain fog is probably the most common that I see.
Okay. Gotcha. Are there any other procedures, from way back in the day that are now causing a lot of problems that they've been in people for decades?
A lot of people in my world are questioning the safety of root canals, which I love the discussion. I think it's an important discussion to have, but absolutely there are concerns that having a root canal done on a tooth, again, just taxes the immune system. The idea is that the root canal system of a tooth, all the spongy little tubules within a tooth, that you can never truly, completely disinfect it when you're doing a root canal procedure. And so that some people really feel strongly that is leading to people having other unrelated chronic illnesses, or that removing a root canal, especially a root canal that we know is infected, that is helping patients feel better and helping resolve symptoms of their chronic illnesses. So it's a really interesting point of discussion. It gets really controversial, which is at the very least entertaining, because I think it's a good discussion and it's a good debate to have. I'm not dogmatic on either side of the issue. I know my colleagues who are endodontists, who are root canal specialists, they're typically on the side of all root canals are fine, they do great, there are no issues at all. My functional medicine, my naturopathic doctors, homeopathic doctors, those colleagues are more on the side of all root canals are bad and all root canals are inherently infected. I think the real answer is somewhere along the continuum between those two extremes. And so it really just becomes a discussion of what's right for a specific patient in a specific scenario, which is great because that just forces us to go back, plus as dentists, to go back to just really good informed consent. Making sure that patients know the pros, the cons, the good, the bad, and the ugly before they make a decision.
Good. So where do you help people? How far out from your practice can you help others? Do you have people flying in, or is it just in the local city that you're in? But where are you located?
I'm just outside of Dallas, and we've got a large local base, and so we've got a good sized practice, but we do have quite a few patients who drive. I would say on average, people are driving about an hour to see us. And then we've got people who maybe they live too far for us to be their normal everyday dentist, but they'll come and they'll fly in or they'll drive in to visit for the day if they need a bigger procedure done, like if they're having one of those root canals removed or if they're having their amalgam fillings replaced or something like that. They'll fly in for that. So we have quite a few that travel.
Well, very good. So what's the best play for someone to, to start reconsidering the dentistry maybe they're getting and to find out how to go a more holistic route? What do you recommend? What do they read? What do they do to learn about what's possible?
Yeah, well, I try to keep a ton of information on our website. So you can always just read the educational stuff that's on our website, and that's www.flourish.dental. And fairly active online, probably the most active on Instagram. So on Instagram, you can find me at Dr. Toni Engram, and absolutely just soak in the information. If it's brand new to you, then get as much information that you can. And then we're obviously here to help if you need us.
Okay. Well, very good. Well, thank you so much for coming on the podcast. I appreciate it.
Absolutely. Thank you. I really appreciate it.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.